The opioid crisis. As defined by the National Institute on Drug Abuse, opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription such as oxycodone, hydrocodone, codeine, and morphine. Opioids are highly addictive and have caused an epidemic known as the opioid crisis. The opioid crisis refers to the rising death and addiction rates to legal and illegal opioids. On the left is statistics and numbers pulled from the National Institute on Drug Abuse and the Center for Disease Control and Prevention. The alarming numbers represent the opioid crisis raging across the United States. The picture on the right shows how many opioid overdose deaths have occurred compared to the population of the area. The opioid crisis is more than just numbers and statistics, though. It is real people struggling to live their lives without the constant desire for opioids. A resident of Johnston County, who wished not to be named, spoke about her struggles with an opioid addiction. It started in her early 20s after the birth of her first child. She began taking leftover morphine pills that had been prescribed from a past surgery. After finishing that bottle, she started to buy opioid pills off of other people. Quickly after she began buying the pills, she was introduced to the illegal drug heroin. She abused pills and heroin for 5 years before being arrested on drug-related charges. She spent a year in jail before being released on parole for good behavior. Straight out of jail, she attended rehab for another year. She is currently still on parole, but is back home living with her son and parents. This addiction took its toll on her relationships, though. She missed seeing her son for over 2 years, and while she was away, forced herself to detach from him. When she returned home, their relationship was distant and cold. She is still working to repair things between them and her other family members. Opioids have a huge impact on everyone and is much more than just the numbers. This is why it is very important to find a solution to the increasing addiction and death rates. The solution starts with the certified registered nurse anesthetists. They are experts in pain management and administer anesthesia and opioids during surgeries. CRNAs also have a lot of patient contact, which places them in a prime position to catch early warning signs of an addiction forming. Continuing education is classes given online and at community colleges that all health professionals have to take. It allows them to be up to date on all new information. If lessons on opioid addiction patterns and safer pain management options were included in CRNA's continuing education, it would further educate them on how to use alternative pain management options and spot addictions early in patients. More opioid-related questions should be asked during preoperative evaluations to determine how susceptible a patient may be to addiction. When performing preoperative evaluations, CRNAs could also administer electrical pain detection threshold tests. There have been studies that prove electrical PDT tests directly correlate with the number of pills a patient used after surgery. By customizing the number of opioids prescribed to a patient, it beats the one-size-fits-all mindset that many doctors possess. It also reduces the number of leftover opioids that a patient and others could use in the future. During postoperative evaluations, CRNAs could use the information that was covered in continuing education courses to determine if their patients could benefit with the use of a non-opioid management alternative. However, opioids would still be used, but the number needed could be decreased if other pain management options were combined. Therefore, it reduces the amount of exposure a patient receives to an opioid. Also, CRNAs can be encouraged to use postoperative evaluations as a time to check for warning signs of addiction in patients. Alternative pain management practices refers to the use of non-opioid pain medications and therapies that help reduce pain in patients. A pain therapy currently being looked into is called TENS therapy. TENS stands for transcutaneous electrical nerve stimulation. It is a device with pads that attaches to a patient's skin in the area that hurts. The pads send out electrical impulses that disrupt pain signals in the body, which reduces the pain sensation felt. This type of therapy would help with patients that have had back or knee surgery because the pain is in a specific area of the body. Another alternative pain management option is non-opioid pain medications such as ketamine. Ketamine can be used in surgery in place of opioid pain medications. In the last few years, ketamine has been used more often than before because of its efficiency and lack of opioid-related side effects. By adding more preoperative evaluations performed by CRNAs, there is a more customized number of opioids prescribed to each patient. The chance of opioid addiction isn't as high if less opioids are being used. Therefore, implementing more opioid-free pain management options would help fight the opioid crisis. There is no one solution to the opioid crisis, but with a combination of these efforts, America could be on the right track for declining opioid overdose rates and performing safer pain management practices.